everyone. My name is Lauren Kane, and I am a master's candidate in the Health and Rehabilitation Sciences program at Western University. Today I'll be presenting my original research titled Conceptualizing the Lived Experiences of Pain and Fatigue in Persons Living with Neurological Conditions. To begin, I will describe some of the background in this field of study. Pain and fatigue in multiple sclerosis, amyotrophic lateral sclerosis, cerebral palsy, and Parkinson's disease have been reported as the most common and disabling symptoms across these four conditions. Pain and fatigue have been identified in current research as being multidimensional, complex, and subjective in nature, affecting motor function, quality of life, and overall well-being of these patients in adulthood. The experience of pain and fatigue is often underemphasized from the patient perspective, as both research and clinicians focus on the visible and measurable effects that these symptoms present in daily life and the life course. Therefore, the primary objective of our study is to understand the impact of pain and fatigue on the lives of individuals with the specified conditions. A secondary objective of this study is to explore the relationship between experiential accounts of pain and fatigue within and across conditions. To do this, the design of our study includes the recruitment of 12 participants, 3 participants per condition, recruited from the MS Society of Canada, the ALS Society of Canada, Parkinson's Canada, and the Transitional and Lifelong Care Program at St. Joseph's Healthcare in London. The study adopts a new phenomenological approach guided by Van Manen's hermeneutic phenomenological method and will use interpretive phenomenological analysis as a method of data analysis. We will be using semi-structured interviews using a biopsychosocial framework to not only focus on the biological factors affecting an individual's lived experience, but also the psychological and social factors. Inclusion criteria for participants in this study: they must be aged 18 years or older, fluent in English, have a formal diagnosis of MS, ALS, TP, or PD as communicated by the participant, and must self-report current and past experience of pain and/or fatigue, and have access to an electronic device. Exclusion criteria for a participant would be if they have severe cognitive and/or speech impairment and are not fluent in English. I've included a sample of some of our study interview questions, which focus on both pain and fatigue. Each question will focus on either the biological, psychological, or social factors affecting lived experience, or all three. Interview questions include: tell me about your experience of pain or fatigue. Please describe a situation where you experienced pain or fatigue. In your own words, can you tell me what pain or fatigue means to you? And how do you know you're experiencing one or the other? Data analyzed from all interviews included interviews from 3 participants: 1 female with Parkinson's disease, aged 61 years, 1 male with Parkinson's disease, aged 67 years, and 1 female with relapsing remitting multiple sclerosis, aged 54 years. All participants experienced both pain and fatigue. Data analysis developed 3 emergent themes representing the experience of pain and fatigue. These themes included negative perceptions of pain and fatigue, coping mechanisms, and a lack of understanding. Each theme has sub-themes representing the experience of pain and fatigue as described by the participants. Negative perceptions of pain and fatigue were described as a lack of energy, cognitive impairment, a lack of muscle strength, heaviness, feeling lesser, hiding, depression, worrying, and time-consuming. Coping mechanisms varied for each participant, but included resting, planning, accommodating, pain management, support from others, physical activity, feeling lucky, and pain as normal. Lastly, a lack of understanding was described by the participant as being lacked by clinicians, patients, and others. Others could include family, friends, or other support systems. Lastly, the clinical implications for this study is that the knowledge gained from the study may help to increase the understanding of the impact of pain and fatigue on the daily life and life course for participants. This knowledge may help to improve the functional ability, quality of life, and overall well-being of these individuals in adulthood, and develop better management and treatment strategies. Lastly, the knowledge gained from the study may help to inform clinical practice and future research by equipping clinicians and researchers with the practical knowledge of adults' experiences. Thank you very much for listening to my presentation, and have a great rest of the conference.